This is Athena Jezik, and this video I'm going to show you a technique using cups to help get muscles released in the body. Cupping is traditionally used with acupuncture. About 15 years ago, an acupuncturist showed me how to do this with just the muscle work. So I do not do the same type of cupping that the acupuncture people do. I work the cupping strictly to help muscles to release and to separate so that there's some spacing between them and they soften better. Usually what happens with the cupping when I use it is when there's been some sort of an injury that's affecting something quite deep below what can be palpated. So I'll be showing you this, although most of her knots are more superficial. I will go and show you for the demonstration how I work these cups. Usually I put cups on different areas where there's either the origin insertion or somewhere in the middle, or maybe on a different muscle where there's a referral pattern happening. So it's a matter of just finding where those tension areas are. With this technique, it's a good idea to have a pretty good amount of oil on or lotion, because it gets a little rough on the person. This is probably the roughest thing that I do on anybody. So with a cup, we'll put this bigger cup down here where on the edge of the lower edge of the trapezius muscle. She does play the guitar, so there's a lot of work that comes out of the back there. And we check this here and pull it up into the, is that too tight? Is that okay? Okay. Now this is going to turn kind of red and circular, and it's a good idea to tell people sometimes little bruises are left with this on some sensitive skin. And this is a little smaller cup because this is more concentrated where the tightness is. So we just simply hold them there for a while. I tend to work around a little bit. And if that's a little tight, let a little air out, and then I move it back and forth along the muscle. So it picks up the muscle and separates the muscle and gives some space into it. So it's a good way to get deep down in without having to do a lot of deep pressure, or to get to areas that are pretty impossible to palpate. Works very well for injuries and different. So we just keep moving it around. It's good to move it around. Keeping it in one place, oftentimes we'll leave those little circles. And that, and let that off, and you can tell a difference, a big difference in how the muscle feels. And up here, where there's a little more restriction, you can see how the redness comes out. It doesn't last very long, unless there's a little bruising, which may happen there. And just sweep the whole area. You want to make sure, though, it's not too tight on the person so that you're really pulling hard on the skin. So it's something that needs to be comfortable. And then you can remove that. Okay, so as you can see, there's a little bit of redness that's occurring. You can see where the cup was here. Although the muscles feel very smooth, the bump in the muscle is just one muscle over the top of another muscle. So there's not any tension in there at all. It's very deep, smooth, nice muscle. Now because I work that a little more roughly than I normally work people, I put Rescue Cream. It's a Rescue Remedy Cream. It's by Bach Flowers. I put that on the area, if it will come out of the tube. I put that on the area because Rescue Cream just helps to settle the tissues down. It takes any kind of sting or pain out of the area, and it seems to, if there's a possibility for any kind of bruising, it seems to not make that happen as often or not as severe. Sometimes the cups, when you see acupuncturists being cupped, they have very big red circular marks all over themselves, and they do turn bruised. I don't like to do that. I don't need to do that in this particular work. So there we have it. That's a little demonstration with the cup. That's another great tool for getting muscles to relax and knots to come out.